Thanks for joining us for this preoperative education program for our total joint replacements who are having surgery at Hunterdon Medical Center. During this presentation, we will be covering the following: an overview of joint replacement. We'll discuss tips for preparing your home for your return after surgery. We'll discuss steps that you can take now to prepare yourself for surgery. We'll discuss the day of surgery and what to expect during your stay. And finally, we'll discuss discharge options. So let's begin. Joint replacement surgery is not a new procedure to the medical community. It has been done on patients safely for decades. But what has changed is the way we care for patients who are having total joint replacement. And when I say joint replacement, I'm referring to patients who are having a hip or knee replaced, and in some cases, both knees. Joint replacement surgery is considered elective surgery. You do not do joint replacement to save someone's life. But because pain is often severe or activities have been limited, the joint replacement occurs to save the quality of a person's life. So to help you prepare, we've developed this educational program. Our goals are to provide you the information you will need to prepare for all phases of your surgery. It's an opportunity for you to plan ahead and think about the things that you can do, along with the things that we will do to make sure you have a successful outcome. And finally, we want to ease any anxiety you may be having. If you don't have any anxiety prior to surgery, you would be a very unique person. We welcome your questions and will pause periodically during the program to allow you to ask them. So why are you here? What were the events that led you to make that initial phone call to visit the orthopedic surgeon? Most patients will report pain. Pain that affected activity choices. Perhaps it's something you noticed first when you were climbing stairs, and then eventually it started affecting other activities that you normally would enjoy. Patients often say that they no longer enjoy going places that required a great deal of walking because of having to deal with the pain that they suffered afterwards. And while there are several things that can cause hip or knee pain, in the case of a patient who is going to be having joint replacement, the cause is arthritis. There are many different types of arthritis. The most common is osteoarthritis. Another form is rheumatoid arthritis. And why a person develops arthritis varies. Perhaps it's heredity, something you inherited from your parents. Perhaps it was an injury that occurred when you were younger, a job you performed. In some cases, patients have experienced an infection that started the arthritis process in motion. Simply stated, arthritis is defined as the loss of cartilage on the end of bones. Cartilage is a flexible, elastic tissue that covers the end of bones that allows them to move on each other without pain. Cartilage is not a very hardy substance, so as we age, it becomes dry and brittle and begins to wear away, leaving the ends of the bones exposed. This leaves arthritis sufferers with what we refer to as bone-on-bone pain, which can be extremely debilitating. Let's review what hip and knee replacement involves. The hip joint consists of two bones. One is the femur or thigh bone that starts at the hip and ends at the knee, and the other is the pelvis. There is a cup in the pelvis called the acetabulum. The head of the femur fits into the acetabulum, and both are covered with cartilage when the joint is healthy. Interestingly, on a regular X-ray, cartilage will not be visible, and it will appear as though there is a space between the two bones. For this reason, an orthopedic surgeon can tell from a simple X-ray if the pain that a person reports is being caused by arthritis. The hip is a ball and socket joint that allows you to move your leg in all directions. What holds these two bones together is a group of tendons, ligaments, and muscles. The reason we point this out is because after surgery there will be some precautions you will need to adhere to in order to prevent a dislocation. During surgery, the head and the neck of the femur are removed and replaced with prosthetic pieces that are sized by the surgeon to fit appropriately. The acetabular cup is cleaned and a prosthetic piece is put into place there as well. It is the same group of tendons, ligaments, and muscles that will hold these two prosthetic pieces together that held your natural hip together. After surgery, these ligaments and muscles need time to heal after being moved and shifted during the procedure. Because of this, there will be a period of time you will need to adhere to hip precautions in order to prevent a dislocation. While dislocation is rare, we make sure all of our hip replacement patients are familiar with these precautions before discharging them home. The knee consists of 4 bones: the femur, which is the long bone in the thigh that extends from the hip to the knee; the tibia, which is the bone we refer to as our shin bone; the fibula, a small bone on the outside of the calf that is not affected during joint replacement; and finally the patella, which is also known as the kneecap. The knee is a hinge joint, and when healthy, cartilage covers the end of the bones so they can move smoothly on one another. These bones are held together by strong ligaments and muscles that will continue to support the joint after surgery. During knee replacement surgery, the surgeon will fashion the end of the femur and the top of the tibia to accept the prosthetic pieces. A piece of surgical plastic is placed between these 2 pieces so they can move freely on each other. The patella, or kneecap, also has cartilage on the back of it. In most patients, this will require some cleaning of the area, and a prosthetic piece is placed there as well. After knee replacement surgery, there aren't any precautions per se. We will be concerned with positioning and encourage the extension or straightening of the knee. In order to walk correctly, you will need to be able to straighten your knee fully.